got some amazing news to tell everyone, haven't you?
We have, and we've just been acquired by Exon Health.
Wow, that's going to be huge. So obviously the stuff you guys do, particularly in terms of helping patients navigate NHS app and get onto the consulting platforms and stuff, and navigating the practice infrastructure, that sits now in front of Exon, is that correct?
That's correct. So when you phone a GP practice and you get offered a digital solution, you get offered to use the chatbot direct from the telephone. Perfect.
And I know, having used and seen the Hanley consulting platform and stuff, the way that it works, it's great. The uptake we've had at some practices has been absolutely astonishing.
Astonishing. We've had sort of 55% increase in sort of missed calls. We've had the ability where online consultations has been just tripled. 80% of people using online consultation tools. We've also had massive increases in the use of the NHS app and repeat prescribing. It's been fantastic, and we've got the dashboards to show the data. Absolutely, yeah. It's really winning. It's working well.
Cool. What do you hope to see the main thing with the partnership with Exon, particularly in the next 6 months? So what you can anticipate seeing?
Yeah, so the main thing for this is all about growth. This is to allow us to actually offer this solution all across the UK, and I feel that that's what we need to do next. Everything's about scale in the NHS these days. Automation, scale. Together we can do that, and of course we've got a big piece of the market with Exon, so we know we can reach a big chunk of England at the moment.
And we're here at Best Practice, so I guess from your point of view, who's the other providers you're keen to talk with, network with, get to know and stuff, aside from obviously Exon?
Yep, well that's the beauty. The chatbot itself is totally system agnostic, so we will work with any telephone company, we work with any website provider, so our system and our solution is available to anybody, so we're keen to talk with, think healthcare, we've got Red Centric, we've got totally different telephone companies that we can work with as well.
Okay, and in terms of integration, that's always one of the challenges everyone talks about with tech and that kind of stuff. What do you see as the big challenges and opportunities for integration in the next year?
I think the big thing we've been looking to do is actually integrate with the APIs directly for the online consultation tools. We're hopefully going to look at doing that with the NHS app as well. So when a patient uses the chatbot, it will launch directly into where they want to be in the app rather than having to go through a process. So there's lots of integration done with APIs, and of course we've got our AI solution coming as well.
That sounds interesting. AI is definitely going to be the big feature, I think, for this and next year in general practice, so we'll see how that develops. Thank you very much for joining us. So, Chief Learners, I'm joined by Max from Hanley Consulting. We've just heard some of the great news that you guys have done. Do you want to fill us back in for those that haven't heard it?
Absolutely. So we're proud to announce that yesterday Hanley Health Limited, known as Hanley Consulting within primary care, has been acquired by Exon Health, the telephone supplier.
Awesome. So what does that mean for Hanley Consulting current users and for Exon Health users at the moment?
Absolutely, great question. So what it means for our current customers is that we can further work with Exon's product team to further develop and integrate the products together. So there's lots of new features and functionality that will be coming out over the next 3, 6 to 12 months. For Exon's customers, what we're looking to do is scale our solutions and services that we offer, whether it be our consulting services that we offer with access optimization, to our digital products such as our chatbot known as EDAT, and also now under the guise of Exon will be known as Surgery Assist.
Awesome. So we're here at Best Practice Birmingham 24. Who are you most looking forward to meeting? Apart from me.
That's a great question. I think there's some amazing speakers that are here. Lots of talk. We're always talking about patient experience, so integration of the products throughout the system, allowing patients to navigate the system better to ensure that we can ease that pain on general practice. And I think that's the most important thing. Having already met lots of amazing people in the last 2 hours since we've been here, and very looking forward to seeing many more. In terms of technology partners and products in the market, I think everybody here is doing a fantastic job. I've been around looking at locum recruitment companies to up and coming emerging EPRs potentially in the future. So really exciting. It's just hustling bustling. It's one of the most exciting best practices shows up into.
And for those that have unfortunately not been able to attend Best Practice, because let's be honest, somebody's got to still do the day job and things, what would you say is the best thing about coming to a conference like this?
Sharing knowledge, not just about the future, but currently what can we do, what are other people doing, how can we take that best practice and roll out in our local, whether it's a community, our GP surgery or our PCNs, to make sure that everybody's working to a minimum standard. So I think think it's really important to come to these places to share knowledge.
And last question, what do you see as the thing that's going to change general practice from a tech point of view and for patients in the next year?
I think we need to look at ways to leverage artificial intelligence. I don't want to replace humans. We shouldn't be trying to replace humans. We should enable the tech to allow tech to do what tech does and humans to do what humans do. So I think over the next 12 months, you're going to see a lot of emerging products that are coming out. There's already a load that are coming out and being worked on. Watch this space. But really excited to see the emergence of AI in healthcare over the next 12 months.
Awesome. Thank you very much.
Thank you.